and the reverse happens if the temperatures are low. When you go to the hospital and if there is a problem with your heart, you can be checked using what we call an ECG, electrocardiogram. With that test, they are able to see how your heart is beating, and then a graph is produced like that. And then a doctor or a cardiologist, someone who has specialized in the heart, cardiology, will be able to identify where the problem is in terms of the way your heart works. Okay, that is the ECG, electrocardiogram. And then it is very important for you to regularly check your blood pressure, especially when you are older, such that we can know that you have a risk of developing what you call hypertension, an increase in blood pressure. Most people are hypertensive that they don't know. So that's why it's very important that you go for regular checks. Okay? When you talk about blood pressure, we're talking about the pressure that the blood exerts on the blood vessel, especially the arteries. So when the blood is coming out of the artery, it is actually pulsating blood. That blood exerts pressure on the arteries. Okay, so that pressure is what we call blood pressure. And there are two values for it. Systolic, when the heart is contracting, and diastolic, when the heart is relaxing. So when the heart is contracting, that means that the pressure is higher compared to when the heart is relaxing. So we write it as a fraction. This one is systolic, 120 is systolic, and then 170 is diastolic. This is not to mean that this is the normal range. This is just any measurement, any person's blood pressure. So when you go for blood pressure measurement, the value that you'll be given is in terms of a fraction. One is systolic blood pressure, another one is diastolic blood pressure. Okay? If you have one which is above that millimeters of mercury, then it's important that you do another blood pressure measurement, and then discussions can be made if you are pre-hypertensive. You are tending towards getting hypertension. If you have hypertension, it is likely that you will get problems with the heart or the cardiovascular system. You get conditions that these cardiovascular diseases, we call them non-communicable diseases, NCDs. Hypertension, stroke, and many other diseases are associated. Heart failure, those are NCDs. So that means that it is very important to control your blood pressure. So that has been our presentation. We have seen that the rate at which the heart beats is very important to ensure that the body receives sufficient blood supply. Of course, when we have sufficient blood supply, we have sufficient supply of oxygen and nutrients, but also removal of wastes, including gases like carbon dioxide, that if they are left to accumulate, they can cause acidosis. So it is very important to remove them out. The process of heart contraction is influenced by a number of factors, mainly hormonal and nervous, the nervous system. But the contraction of the heart is initiated within the heart, and that's why we call it myogenic. Thank you.